Okay, hello everybody. Welcome to episode 13 of That Moment Heart to Heart Talk with Victoria. I am here with Dr. David Ajibade, and I'm so excited to have you on. Before I introduce you and let you tell the world who you are and what amazing things you're doing, I just want to share a little bit about what That Moment is. It's still a very new show. It's really about highlighting incredible people in the world. Today I have an incredible guest who's doing wonderful things internationally and really highlighting their stories of going from struggle to thriving or triumph. We all have those moments in our life that bring us to our knees sometimes, that have us have these aha moments, and really bring us sometimes to the passions that we then facilitate and bring to fruition in the world, contributing to others. So I love talking to incredible people. And today, Dr. David, as I call you, tell us, how are you? Where are you coming from? And what do you do in this world? Who are you?
Oh, hi, Victoria. Thank you for having me on. Yes, I am in Dallas, Texas currently. I'm originally from Nigeria, and for the last 3 or so months, I've been living out of my suitcase, traveling from city to city in the U.S. To raise awareness about the work we're doing with sickle cell disease in Nigeria, which has become a big-time passion project for me, because you may not know this, but we have, I guess, let's see, a quarter of the world's about a quarter of the world's population of children with sickle cell disease patients live in Nigeria. Most kids will die by their 5th birthday. The rest will die by their 30th birthday. Most of the rest, I mean, very few will survive past that. And we've pretty much been treating them the same way we've been treating them for the past 30, 40 years. And the amount of pain and suffering and agony that I've seen among the patients themselves and the parents and the families has been heartbreaking. So we just decided to try and address this and see what we can do to reduce the burden. So that's what we're into right now.
Wow, that's incredible. That's really incredible. And are those the statistics just all over the world or in Nigeria?
We've been looking for statistics to show what it is all over the world. And we haven't, in fact, I checked WHO. I don't think we've gotten the overall statistics. All we know is that most of them are in Africa, India, in the Middle East. A lot of Arab countries are affected by sickle cell disease. Just about 100,000 in the US alone. But we have 150,000 being born every day. Every month, every year in Nigeria. You have 100,000 in the US, and there's a lot of research, a lot more attention is being paid to that 100,000 than there are to our 4 million in Nigeria. So we just felt that was unacceptable. We needed to kind of like make a difference there. But that's become a side project, or the main project. Our main focus has always been on brain disorders, on how to address those brain disorders in third world countries where we don't have access to all the, the super duper gizmos like the fMRIs, the Dopplers, all the other good stuff that you all over here have easy access to.
I know. And as you say that, I'm just brought to feeling gratitude and then also just humbled by the fact that, there are places in the world that are not resourced the way that our Western world is in many ways. And so I think it's incredible what you're doing. I know that when you say brain disorders, can you share a little bit? I know autism definitely in the title of this, conversation, and something that is near and dear to my heart in my research. What other conditions are you talking about when you say brain disorders?
Right. You're right. It's a pretty wide field. So everything from learning disabilities, poor academic performance, genetic disorders that affect the brain, like Down syndrome. You mentioned autism. Cerebral palsy is pretty big back home, but especially in other third world countries as well. In Nigeria, particularly, 70% of all births do not happen in a hospital. They happen outside, maybe in a church or a traditional home and all that. So you can imagine that there's a much higher likelihood of something going wrong. during that birth process, the prolonged labor, all kinds of issues. And so if there isn't someone to a qualified specialist to intervene, I mean, a lot of damage could happen, and the brain is the first casualty because it's the most sensitive. Excuse me?
You said it's the most sensitive?
It's the most sensitive. It needs oxygen. It's the most sensitive to lack of oxygen, lack of blood flow, lack of nutrients. So once it's in crises as it's coming out of the birth canal and it gets stuck, you don't give him or her the oxygen that he requires, the brain is just going to switch off, just like it's going to get damaged just like that. Wow. I mean, the other parts of the body are more sturdy. They can resist, and they can last longer without oxygen or blood flow. But the brain does not. The brain is extremely, extremely demanding of those things. So as soon as that happens, it goes off, and then the parents are left to a lifetime of having to deal with a kid who just for a few seconds did not have oxygen. So we're dealing with all those things, and these are conditions that were considered impossible to treat. So they would just send them to for physio, and that's it. But now we're beginning to see things turn around just like that. As a matter of fact, someone just called me this morning. She called me from Nigeria saying, "Oh, that the things we sent to her, and by the way, we provide these things free of charge. Some of them pretty expensive. Things we sent to her." She said, all of a sudden, the child is now able to have better neck control. Is not trying to walk, not trying to crawl. These are all things that the kid absolutely could not do. So it is very, very, very gratifying. Yeah, so cerebral palsy, seizure disorders.
My phone thinks you're amazing, obviously. So it all sorts of noises. Sorry about that, technology. Say the last thing again. So the person called and said that their child is able to do all of these things that normally they didn't see the child do. And it was due to what you implemented. Is that right?
Yeah, correct. So the key had been, okay, what like we said at the beginning, we don't have access to all the super duper gizmo, the neurosurgeons, the neurologists, the super smart experts, but we just apply first principles. What does the brain need to thrive? What specific nutrients does it need to repair itself? And we went around searching for some of the best quality nutrients and getting them, and then we provide them to these patients, and then within weeks, usually we see results that they've been searching for years.
So let me ask people that are watching, I'm curious, and I've asked you this before, if this is so effective, and I believe it, right? Because there's so many, just going back to the basics and really understanding that in a masterful way. Why is this something that more people are not getting into and understanding about? Like, what do you think that is about?
Well, let me put it this way. There are three professions I know that are very hard to change their ways, right? the educational field, the clergy, whether church or mosque or anything, or religious factors. And I would say the third is the medical field. And with good reason too, because for a medical doctor to change what they're doing, they have to be presented with the data. It doesn't matter if you show them all the people who have been raised from the dead. If you don't provide the data and you ask a doctor to change what they're doing, I mean, a doctor puts himself or herself at risk. Yeah. Because if anything goes wrong, whether it's related or unrelated to that intervention, they could lose their license. Right. And so they have to stay on the straight and narrow. And unfortunately, there hasn't been much attention and funding being pushed towards the kind of things that I do. It's funding, developments, treatments, drugs go where money, they go where the money goes. And drugs cannot do what we do. Right. Drugs cannot do, because what is required is an upregulation of the body's ability to heal, correct, regulate itself. Drugs take the work and do it themselves. What we do is to present the body with the resources and the environment that it requires to make the changes. So we just sit back and watch, but we make sure that the body has the resources it requires. And many times we're right. because the body has this amazing potential, as you know, Victoria, to do a lot of crazy things, including heal itself and regenerate and even produce new brain cells. So that's been pretty exciting. So long answer to your question, it's just not being given the attention it needs to, and until data is presented, until we highlight some of the things that we are finding into the academic fields, it's just going to remain in a niche, tiny little part of the world, I guess.
Well, I knew the answer to that question. I'm just glad that somebody else said it, not just me. It's true, right? I mean,
yeah, I guess.
Well, it's incredible how much we just in the society don't know about, or how much parents who have children with different challenges and atypical needs don't know about because of the lack of access to that information. Why? Because it's just not widespread. And so, we have these, generations of people that just go along with whatever shared is possible, right? Or whatever is shared with them, not necessarily being given the whole plethora of choices that they can have. So I think what you're sharing about is important. And what you're doing is important. So can you share a little bit more? So what does that look like when you're working with a kiddo who is experiencing those challenges? I know that there's herbs involved and just very natural, holistic things, but what does the treatment look like, just so everyone can better understand?
Right. So obviously it depends on what the problem is. So if you want to choose one, or should I just randomly pick one?
Autism.
Autism, of course. So autism, Victoria, is the one thing that we do differently than any other thing. So with all the rest, like
I'm not surprised. I mean, all the things I know about autism, I'm not surprised. Go on.
You know, Winston Churchill once called Russia. He said it's a riddle in a mystery in an enigma, something like that. And I'm like, I feel the same way about autism as well. Autism is just one crazy riddle. I mean, the second you think you've gotten a handle on it, you're like, yeah, this is what can solve the problem. All of a sudden, another kid shows up, throws you a curveball, and everything you learned and knew before just goes out the window. You got to start again from the start, start afresh. So it is a crazy condition, and my heart goes out to those parents who are really trying to deal with the condition, because some can be very, very distressing. So I was saying that it's the one thing that is different, because other conditions like cerebral palsy, seizure disorders, learning disabilities, we're just focused on, like I said, giving the brain the resources it needs to fix itself. So just like, okay, it needs this, take it. In autism, the opposite is almost the case. In autism, you have focus on taking a lot of stuff out. And let me explain this. In most cases of autism, the problem started during pregnancy. And many people may not realize this, but started during pregnancy. A lot of it, not all of it, but a lot of it has been attributed to the mother and the child interaction, some immune dysregulation that affects somewhat the child's brain, but also the child's gut, digestive system. And so by the time the child comes out of the gut, is born by the mother, things are in a state of flux. They're not apparent right off the bat. Usually that's the problems usually begin to arise before the third birthday. And there's a reason for that. It has a lot to do with the gut bacteria and the regulation of the gut bacteria. Most kids don't have a fixed or the adult gut bacteria microbiome pattern until the age of 3. So before that time, they're in a constant state of flux. And this brings us to the gut-brain connection. What we found out with autism, especially with autism, is that if you don't address the gut, you are pretty much chasing your tail. And I see many parents and all that, they're doing all the great tests, all the wonderful tests they have access to, but they're not addressing the core problem in the gut. So when a parent comes to me and they explain. They've got to fill a questionnaire. I sit down with them. We go through the whole process. Usually, there's a point in which they notice something went wrong, and then we start asking them about their the gut habits. Many times, the kid is constipated. Many times, they say the kid touches his stomach with this pain, or wakes up at night with pain. They may have very restricted dietary habits. They may become hyperactive when they eat certain foods. So we kind of like look at all those things. There might be head banging involved. There might be fecal smearing involved. I mean, all kinds of things going on. And I try to explain to the parents after we've gone through the whole checklist and heard as much as I can from the parents and looked at whatever tests they've done. I try to explain to the parent that the majority, I would say 80% of these kids' symptoms, 80% of these kids' symptoms do not originate in the brain, but they originate in the gut as a result of, and of course, you know a lot about this, as a result of the dysregulation or dysbiosis. Usually there's supposed to be a nice, even ratio. You've got to have a lot of good bacteria, like 85% to 15% bad bacteria. And not just bacteria, obviously. You talk about candida, yeast, viruses, fungi, all the other things. I mean, there's a whole bunch of different microorganisms in the gut, but essentially it should be 85 to 15%. And I explain all that to them. I say, this is many times with kids with autism, that balance is disrupted.
Yeah.
They have a lot more of two main things we've seen: yeasts, that's candida, and clostridia, that's a bacteria. And these are the two main things that we've seen over and over that cause problems. We also know that there are certain bacteria too that are conspicuously absent in these kids who have the autism. And so the goal that we try to the goal is really to clean up as safely as possible the gut, to take out as much of everything, just kind of like do a clean sweep, but safely, like I said, and then now replace with the good bacteria, the good germs. And also you got to work on healing the gut as well, because for most of them, they've had damage to the lining of the gut, which many times has led to what is known as leaky gut syndrome, where the bacteria and other not properly digested food elements has leaked through the gut into the bloodstream and has gone on to affect the brain. So there's a lot of things going on in the brain as well. But our goal is that it's like in the storm. The first thing you want to do if there's a leaking roof in a storm is to fix the roof. Then you can deal with the decor and the internal design and everything else, and the floor and everything else in the house. But if you don't take care of the roof that has been damaged, you're just going to continue to reinvent the problem.
What is where you're putting it?
So that's kind of like what we kind of look at. And of course, being in Nigeria and Africa, we can't do the specific tests and all that, but we've done it so many times, and we've worked with people in the US who have done it so many times, that you can safely assume that this is what the situation is. Besides, we don't use drugs at all, so we don't do anything that could be construed as harmful to the child. I mean, everything we do are pretty much safe. Yes, what we use are nutraceuticals. They're not necessarily herbs. They could be extracts from herbs, which have been concentrated and maybe adapted so that they are more bioavailable or more accepted by the body and have fewer side effects. So I mean, like, again, it takes we've had years of just looking at the ones that work and picking and choosing and then putting them together in like a kit, an approach, especially for the first 2 months where we're cleaning up the gut. So that's, like I said, we're trying to prepare it, clean up the gut, putting the good stuff in, and then it's a long process of just ensuring that the gut is healthy. In other words, if you were to look at 2 5-year-olds, or an average of an average 5-year-old, looked at the average 5-year-old's guts, and you looked at the average 5-year-old with autism's gut, if you were to look at both of them, you would see some very, very, very clear differences. Very clear differences in the mixture or the balance of microbes the health of the lining of the gut, the movement of the gut, which is called peristalsis, how rapidly the food is pushed down the gut to the other end. All in children with autism, that is hugely affected. It's much slower. The movement is much slower in children with autism. So we look at all those things and try to see, okay, how can we improve that gut health? And I'm telling you, the more healthy these kids' gut become, the more healthy their symptoms become.
So and this is fascinating, and I just can listen to you forever about this. This is fascinating and important because, you know, people are dealing with, and I work with a lot of parents who are dealing with these two, I mean, many spheres, but these two spheres of understanding their child. You know, one, the behavioral and just sort of relationship aspects, which are huge in you know, having autism. And then there's this other realm that often goes unspoken about or unnoticed, and parents, as they go along their journey, may hear, and many do hear about, you know, the body, nutrition, the you know, the gut, the microbiome, like, you know, what is all these things, and then start to become curious about, you know, what could be done. So what you're talking about is a huge piece of really being able to understand what we're dealing with, what's in front of us, what can we do tangibly. And what we can do, what you're saying, is really pay attention to nutrition, pay attention to what's going in and out, and pay attention to how the body is functioning and what the differences are, just to get to know it. And I love how you just described all of that. That's very clear. So in addition to the amazing work that you're doing, I want to know a little bit about you and just, you know, what has happened, or what is that moment or those moments in your life that have created, you know, who you are today? Because you're a force to be reckoned with, a quiet one, but definitely a force to be reckoned with. Tell us a little bit about your story.
Okay. Well, let me see. Where do I start? There's been a lot of misdirection and pain and suffering and regret and like, okay, oh man, maybe I went through all this paths for this reason. And it's like, it's not coming together now. But when I was going through it, it was like, what are you doing? So really quickly, I was training to be a radiation oncologist back in Nigeria, and I left all that because I was disillusioned. I just felt that there were gaps that were not being addressed, and if they were addressed, we would get better results. And I've always been interested in the total man, so to speak, how to strengthen the spiritual aspect, because we all have spiritual aspect, the mental aspects, and the physical aspect. And I felt that if we get a philosophy together that addressed all three components of the human being, and we applied them, whether in sickness or in health, we could get better results. And so I came to the US in search of those answers, and didn't find them all in one place. I can tell you that. We had to. I still can't say I found all the answers for sure. But I was able to piece these things here and there. And then I told you before, Victoria, about how I got involved with a company that was coming up with amazing nutrients. It was actually through Ben Carson, Dr. Ben Carson, the former neurosurgeon. He had gotten tremendous results from, he had aggressive prostate cancer, and he used nutraceuticals. By the way, nutraceuticals are like, best way to describe them are they are supplements on steroids. Supplements on steroids, lost like higher, almost like drugs, but they're not drugs.
But not drugs, got it.
And he used them, and in his books, he describes how he got relief within 2 weeks. And this was very aggressive prostate cancer, like he said. And he being one of my idols, I was instantly intrigued. So I decided to learn more about nutraceuticals. I got involved in the company. I became one of their doctors on their speakers bureau. So they began to fly me all over the country to speak about the technology behind these nutraceuticals. And I learned a lot. It was fantastic. Eventually, we started a webinar business my friend and I. And then we started getting to know about other great healthcare professionals, other doctors and researchers who are coming up with fantastic discoveries in their different fields, whether it's with cancer, the immune system, the endocrine system, the brain. I mean, just amazing things that you would never have dreamed of were possible. And they were getting these results, and it was like, wow, I felt like I was in heaven, and all this information was coming to me through the webinars. This was like 2007. This was before people started taking phones into their bathrooms.
Yeah.
This was way back before anybody knew what Zoom was. So, I mean, we were like, and everybody was so excited. All these doctors, I mean, many of them in their 60s and 70s, they were like, finally, somebody's going to appreciate my work, you know, so I'm going to get my work out into the world. So, and it all came our way. So it was fantastic. And so I learned all that. But in the middle of all that, I had problems with my visa, and I had to go back home, and I was crushed. I was devastated. I was like, gosh, man, I thought I was going to stay here, raise a family, and you know, make $1 million and be happy. And all that crashed on me. So for about a year, it was terrible. But slowly, I began to realize. I mean, of course, I had lots of support from my family and my mom and all that, especially my mom. And then we began to come across kids, parents who had problems with autism, kids with cerebral palsy, learning disabilities. And as they would come my way, I'll be like, hey, wait a minute. I remember this webinar where this doctor talked about this and how effective this works. So I call the doctor up and I say, hey, could you send some of that stuff over? And they would send them over to us. I would give them a try. And within weeks, it would work.
Wow.
And so on and so forth. I was like, okay, maybe all that stuff I had to deal with in the past was, it was a big struggle because I couldn't work when I was in the US. I mean, I was on a student visa, so I wanted to stay true to all the rules, all the restrictions I had. I couldn't get a full-time job and all that. So, I mean, I was really living hand to mouth. And for a person who was a doctor who already was all these qualifications, that just wasn't the right thing to do, in my opinion. It was like, and I saw my course mates, people who had gone to school with me, doing super well, who were already doctors, and had their double board certified, triple board certified, and they were doing super well. And here I was still struggling. I mean, it affects your psyche. But it now began to come to me that I was like, oh wow, all those things I had gone through was to be able to serve in this capacity. And we began to work on it. So it's like I can imagine, I can say in the last 5 years now, we've given medications and treatments, nutraceuticals worth over $500,000. Wow. And we've made a huge difference in over 500 kids. I know that's not a large number, but when you think about brain disorders and sickle cell disease, these are untreatable conditions that would cost a bunch over here to treat, and we've been able to make a huge difference in their lives. Plus, we've been able to do video recordings and carefully document all these results we're getting, so that people can actually see that this is not just just hearsay. This is actually happening.
And you've got tests. I mean, I urge people to, is it brainandbodyfoundation.org to go there? Because you've got lots of testimonials of families and parents just talking about how, this has impacted them and their lives. And so what was it, a mindset shift? Was it, you mentioned your mom, and we have these very pivotal people in our life who, create, push us a little bit when we just feel like we want to back down. Right. So what was it? Was it a mindset shift? Was it something that was it faith? Was it your mom? Like, what was it that had you just have faith and keep going in whatever direction you were going in?
My mom certainly played the most important role in my family. She made it clear that I hadn't failed. Because
you hadn't failed?
I hadn't failed because that's what I felt. I felt I was a complete and total failure. And you have done it from the African mindset. You go abroad. If you're coming back, you come back as a conquering king with all the bells and whistles, all the money. You're saving the community. Da 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 da. And I didn't. And of course, you have to come with a family and all that stuff. And I didn't come back with any of that. Of course, she was deeply disappointed, but she didn't let that show. She encouraged me. She supported me. The things I needed, she put together for me, and she was just there for me. And that wasn't the same I could say about others. And then of course she was running. She has a school. She's been having it for about 35 years, and she asked me to come help her in her school, and helping my mom, who has probably been the most important factor in my life. I mean, she helped me go to school and to the U.S. in the first place. Wow. I felt it was a way for me to give back, just give my efforts towards helping her school do well. A lot of things that needed to be changed. She's getting older, so she's not able to be on top of things. So I was able to point out these things to her, and they were able to change a lot of things with regards to that admin, finance, and all those things. I was able to point out to her, and I was able to be on the ground for her to see these things. And I think that helped because I felt useful for that at that point. I felt, and of course for my mom, I felt okay. I was feeling that I was given back in a way, and it's a powerful thing when you feel that you give back to someone who has done such a great, been such a great influence. So yeah, that's really what it was. She was just supportive, super supportive.
That's amazing. Yeah, I think this is the first time really highlighting, and me talking to a lot of different people about their life stories, where we're really highlighting the importance of people like your mom in life, who are just like silent, or sometimes quiet, but like very, very powerful forces. That's incredible.
Yeah, absolutely.
And do you feel like over time, as challenges do come up, you've been able to deal with things in a different way than you did prior?
Yeah, great question. I've learned a lot of patience, that's for sure. And initially it was like, gosh, I need this now, dadgummit, go on, give it to me. But now I've had to really realize the importance of social influence, how to be patient. If you're not getting the answers this way, you have to go around the other way. Like for instance, now I had to get a lot of approvals from the Ministry of Health to get it done. And gosh, you have to go there almost every day and call. I learned the importance of, butting up with the admin assistants. I tell you what, those ladies who work for the Minister of Health or the important directors in the ministry, they can get a lot done for you. A lot done for you if you get, even if it's just M&Ms you're getting for them. They will do a lot. So I've learned the importance of other people and what they can do, of respecting other people and just being nice to other people, because they can make a huge difference. So.
You're talking, it's so wonderful because you're talking about such basic things, right? And basic to us because we, know about it, and we know how much, influence we can have when we really listen to people and build rapport and really get to know them, right? But what you're talking about is super simple. This is stuff that we can teach our kiddos, right? Like in school, and we do, but you're bringing it back to the basics across the board today and just how important that is. I love it. I love that. So what's next for you? What is it that you're up to? What is it you're doing? I happen to know that you're raising money right now, so I definitely want you to share a little bit about that. What are you raising money for, and what's next for you, and how can people find you if they're interested in learning more about how they can help their family members?
Okay, great. Our goal is to start a 6-month research project beginning in maybe mid-January or late February to, let me take it back a little bit. Our goal is to really end or drastically reduce the suffering of individuals with sickle cell disease, especially those below the age of 10. We've been able to prove that conclusively, that kids, especially the younger ones, don't have to suffer the way they do, and some of them suffer terribly. And simply by using simple nutrients in targeted amounts at targeted times of the day can make a huge difference. In order to get to that point, we have to get doctors and healthcare professionals to start treating in that same approach. For doctors and healthcare professionals to do that, they need to be commanded from on high, so to speak. There needs to be a policy change from the Ministry of Health to get them to start treating in that way. Before we can get that policy change, we have to have the research that demonstrates that this is credible, this is compelling evidence and data for them to do that. So we've got to go through all those stages. And that's why we're doing the research, to provide that data and provide that evidence. Once that is provided, then we can push on to the end. So the research is about $200,000. And it includes a lot of things, including it takes care of the medications, the supplements. Yes, the doctors, the healthcare professionals, the hospital fees, the clinic fees, the research fees, and yes, including the patients. We have to pay the patients to come to the hospital and pay patients to come back. Yes, we're giving them medications free of charge. Still, you don't take care of the transportation, they're not going to come. So there's a whole bunch of things, including lab tests. And in fact, the lab tests are pretty much taking a huge amount of the costs as well, because we're doing kidney tests, liver function tests, blood tests, and these all can really add up. So to make it a really good study that can be accepted internationally, we've got to do it right. And so that's why we're taking the pains to get all this together.
I love that you just said all of that and took us through it, because I don't think people have a clue sometimes how much actually goes into creating an efficacious, study that really speaks internationally to a lot of different voices that have influence in this realm. So thank you for going through all that. And how can people reach you to donate or to find out more?
On our website, there's a donate button on our website right there, so you can just click on that. We're also working on a text to donate that may be coming up anytime. So we're going to try and make it as easy as possible for you to donate, and you will be doing a really, really good service for humanity. I know there are lots of other competing things for donation, but you would see the results really quickly with this one. So I encourage people to donate.
And how can people get in touch with you? brainandbodyfoundation.org. And do you have a LinkedIn or a Facebook, or what's the best way to get in touch with you personally if somebody wanted to do that?
So LinkedIn is Dr. David Ajibade. On Facebook as well, David Dio Ajibade. When you look for David Ajibade, you'll probably see me there as well. Yeah.
And Dr. David, my friend, I just want to ask, is there anything that you want to leave people with today? It could be a quote, it could be a message, anything that maybe we didn't touch on, but is something that's near and dear to you.
Oh, this really great quote I like. It's called you remember the dignity of simplicity. There's so many times we think about the more complex reasons, and it's like, oh yeah, because it has to be, because this person has all the degrees and all certifications. Sometimes the answers can be simple and straightforward, and sometimes it requires a more complex approach, but other times it can be simple and straightforward. And that's what we've come to learn in all the things that we've been doing. We've come to realize that the simple things are usually the best.
Incredible. Approach. I love that. Remember the dignity of simplicity. Thank you. Thank you so much for being here with me. And I just love talking to Dr. David. He's incredible. Please do go and visit brainandbodyfoundation.org, donate, and find out more. And all the families out there with children who are on the spectrum, this is a really great opportunity to also tune in. You have a channel, do you not? David, do you have a channel?
I'm sorry?
Do you have a channel that you didn't talk about?
A YouTube channel, yeah. Brain and Body Foundation as well.
Awesome. Yes, please tune in, because some really, really great stuff on there, free information, and really just to have a little bit more foundational understanding of what's going on. I think it's incredible. So Dr. David, thank you so much again for being here, and we will talk soon.
Thank you, Victoria. Enjoyed it.